Welcome, everyone, to the College of Health Graduate Programs Information Session. As you see on the screen there, I'm Choi. I'm a professor in the College of Health, as well as currently serving as the Associate Dean for Research and Graduate Programs. My colleague, Dr. Albert Liu, is the Director of the MS and PhD programs. And then Jen Top is our Student Experience Manager, works closely with Jay Crozier Christie here in the College of Health also. So welcome. Next slide. So this is a little bit about our College of Health graduate degree programs and why it's important and why this College of Health was created to reduce health disparities in underserved, marginalized communities. And you can see a couple of these statistics and why, as a graduate of College of Health, it is encouraging over the next decade or so that employment opportunities in this sector will grow by 15%, as well as you can see there, 240,000 new jobs per year and 2.4 million new jobs overall, opportunities in this health and health outcomes sector. Next slide. So our graduate programs, as you can see on this slide, consist of several master's programs, as well as joint or combined, as well as the PhD. So on your left, you see the MPH, Master of Public Health, the MS, Master of Science in Population Health, and then we have a joint MBA/MPH, where for an additional year, those in the MBA can get the MPH degree. And the 4+1 are combined. You start doing that as an undergraduate, and then again, for one additional year, you can either get the MPH or the MS degree. We also have several certificates, and then the final degree on the very right is a PhD in population health. Next slide. So all of these, you have options. Obviously, you can go full-time, part-time, and go in-person or remote or hybrid. And currently, a lot of our master's, MPH or MS courses are offered in hybrid, where you can take these classes remote or in person. Next slide. So the first one, MPH, stands for Masters of Public Health. And by the way, this is one of the most recognized degrees around the world, the MPH is, and it prepares students to work in a variety of settings, from public, local, state, national, and global public health agencies, everywhere from public health practice to as well as public health policy making. And again, they can work in private or public. So it's a very flexible, broad degree of public health. And again, it's meant to accommodate working professionals. So we have non-traditional as well as traditional students who participate in this degree program. Next slide. A little bit about the admissions. So you can see there, I'm not going to read every little bullet, but the general numbers in terms of GPA, required minimum, what's required in terms of the additional application materials, 2 letters of recommendation, a personal statement, which is very important, right? We ask, why do you want to go into public health? And this is where you can address it in your personal statement. Now, official transcripts at the time of application submission are not required. Obviously, we require that before you enroll, but official transcripts from your institutions. But at the time that you apply, I think you can submit unofficial transcripts. We no longer require the GRE, so you do not have to take the GRE. And you can see there the 2 deadlines, April 1 for international and May 1 for domestic. And you can see the 2, the deposit that's required. The MPH, like all the other MPH programs in the US, whether they're freestanding programs or schools of public health, are 42 credit hours. And our program is exactly the same as 42 credit hours. And our strengths, driven by the faculty strengths in our college, is data science, practice, public health practice, and then community health, as well as global health. So you take a core set of public health courses, rounded out by additional courses in data science, qualitative research, leadership, culture, and health and policy making, some electives. And then the final credits consist of an experiential learning opportunity. And then, as well as you see the last bullet there, there's an internship and capstone, where often it's almost like you are interviewing for the job, because a lot of cases, a lot of these agencies, public and private, end up hiring our graduates who do their internships and capstones, local, private, public companies. Next slide. So the next degree, graduate degree, is MS in population health, and this prepares our students to address determinants of health, right? Focusing on data science and epidemiologic methods to develop novel and effective methodology for disease diagnosis, prevention, promotion, and intervention. And so again, this one probably has a little bit more quantitative emphasis, right? If you were to sort of compare public MPH and MS, you're looking at a little bit more quantitative skills and methods to work. And again, these classrooms are hybrid to accommodate non-traditional working professionals. Next slide. And you can see here the admissions requirements for the MS degree. Again, GPA of 3.0, 2 letters of recommendation, and a personal statement. Again, here we're looking for, why you would be interested in this degree compared to the MPH. And again, we're looking for that in your personal statement. Again, official transcripts are required before you enroll, but at the time of the application, we will take unofficial transcripts. Again, no standardized GERE exam is required, so you do not have to take that. And you can see the application deadlines are the same for the MS as the MPH degree. The deposits are the same. The MS degree is 42 credit hours, similar to the MPH, but the focus here is on data science, quantitative research methods. Again, you take core population health courses. I would say there is slight overlap, but most of these courses now, additional courses, are in data science, research ethics, policymaking, and electives. Now, the difference here in the culminating experience is this is a thesis project, right? Whereas the MPH was more applied, practical capstone. Here, you're trying to answer a research question, whereas the traditional thesis, you can work with data sets to answer a question, analyze the data, and publish your work. You can also publish work with MPH, but again, this is more of a thesis compared to the MPH. Next slide. This is a MBA, MPH. So again, targeting MBA students, you get 2 degrees in 18 months if you're enrolled full-time. So the MBA program requires a full-time enrollment. It's designed for those interested in public health. And so again, you can work in private pharmaceutical biotech companies and occupational health, healthcare, and so forth. And so here you have a mentor team of faculty advisors, including industry executives and career coach. You apply through one MBA process. You apply through the MBA program, and then the MPH comes at the end of it. And so it's toward the tail end of your MBA program. Next slide. So here, the admissions, these are admissions curriculum through the MBA program. Obviously, you want your CV, 2 letters of professional recommendation, personal statement. There's an interview for the MBA program, as well as a transcript, same thing. Now, in the MBA, it says here GRE, GMAT is optional, but not required. And For sort of additional details on that, obviously you can go to the One MBA website for more detailed requirements about the MBA program. Application deadline is a little bit different here, March 1 and April 15th. You see the deposits there. The curriculum there for the MBA, you see there are 74 credit hour credits total, 47 of which is the MBA, 42 is the MPH, 15 is the shared credit, right? They're sharing 15 of those between the two programs. And that's what allows you to get the additional MPH and the MBA in a much shorter period of time. And you see there courses in business fundamentals, and then you would tap into foundational courses in public health. And again, you can take additional courses in qualitative research, leadership, policymaking, and so forth. And again, for the MPH part, you're talking about capstone internships and applied experiences in real world setting. Next slide. So this is the 4+1 where you for undergrad coming in. Again, you can be a current College of Health or HMS major. You can see the GPA requirement, 3.5 or better. And you are directly admitted to the 4+1. Now, if your GPA is below a 3.5, then we'll require you to submit an application. And the way this works is during your undergraduate years, you can take 4 graduate courses during your junior and senior years. That's what allows you to complete the MPH after you graduate in 1 year, right? So this is where you're given the benefit of taking undergraduate courses during your undergrad. And also, as you see in the second column here, how you're able to save money in that sense, right? You're getting a 20% tuition scholarship because you're taking it during undergrad years. And so during the MPH or MS in population health, you're getting a 40% savings on graduate degree. And you're able to, again, achieve both the bachelor's and the master's degree in 5 years. And so, you know, as I told, we had a recent in-person session. If you want an MPH or MS degree, and you are currently a current College of Health or HMS undergraduate student, it absolutely makes sense to start this program. It's a no-brainer for me. If you want to get the master's, why you wouldn't do this? Next slide. Okay, and then so as I mentioned earlier, we have certificate programs. Most certificates are 12 credits consisting of 4 courses. It is a non-degree program, but credits may be applied toward a master's degree. So let's say you want to get a certificate in population health or global health, and you decide, hey, I want to actually get a full master's degree. It is an investment. It is not a waste of time. We apply all of those credits toward your master's degree. So again, either certificate in population health or global population health may be applied towards either master's degree. So it's a way to get your feet wet, and you want it further, and you get a further degree. Next slide. Okay, and the last degree is the PhD in population health, and unfortunately, applications are closed for this fall, but for fall of 2024, we're open again in June. Like any PhD, whether it's in population health, it prepares students to pursue independent line of inquiry, right? So I would emphasize that. The purpose of why anyone gets a PhD is exactly that. You want to pursue your independent line of inquiry, develop your own body of population health research, right? Through the way we prepare you, obviously, is initially through coursework, experiential learning opportunities, research projects, and engagement with traditional and non-traditional partners. All of this is done in close partnership with a mentor, right? With a faculty advisor. So when you come, you will have a mentor and faculty advisor that aligns closely with your research area. Then you can see the minimum of 72 credits, as well as MS in foundational coursework, concentration courses, and then obviously like all of the other PhD programs, you have qualifying exam, you have a dissertation proposal, and then various dissertation stages, but you are constantly working very closely with the faculty mentor, and then you will round out your committee who will guide you throughout the whole process. Next slide. And again, these are, by this time, you should have memorized all of this. The 3.0 GPA, this is no different than the other programs, right? Now here, I think we're asking for 3 letters of professional recommendation, your CV, personal statement. Another difference here is we're looking for, asking you for a sample of your written work, right? And here, unlike the other programs, we actually now require an interview. We want to interview you. Same thing with official transcripts. We want unofficial transcripts to begin with, but official has to be on record before you enroll. And again, no GRE required. Next slide. So this obviously deals with language proficiency. There are actually several options, and this English proficiency is required for all international graduate students. This is a requirement of the university, right? I think not just our college, but across university PhD programs. So you have several options. You see here, one option is you can have earned obviously an undergraduate or a 2-year graduate program from an accredited university following an English dominant educational background. So this is US territories, and so forth. You can just read the rest of the countries yourself on the slide, but less than required years additional documentation is required if you don't meet these years requirement in the US or territories. Next slide. So this just goes into, again, sort of all the next, you can see here on the bottom slide, these various English test scores, so things like TOEFL, Duolingo, in combination with sort of the other intensive English program. And here we review these. And so, you know, I would say if you have any questions on this, obviously we have an Office of International Affairs. You can find their website on go to Lehigh University. They can handle all of these international language proficiency questions. Or obviously email our College of Health on questions related to this. But this is just getting at your language proficiency. Next slide. And again, these are some additional official tests. You can take the TOEFL, IBT, IELTS scores, or using Duolingo with the required front-facing camera. So again, I think you have 3 options. I don't think there's option 4, but actually you can meet all of these requirements through all these options. Next slide. Okay, so you know, our College of Health is, you know, in describing our faculty expertise, by the way, which we are growing. We're currently at close to 20 faculty, but every year we're growing. This year we have 10 faculty searches, and we are growing. What you see here in terms of data science, epidemiology, health policy, health services, social service, social issues, anthropologists, environmental health, mental health, immigrant health, sleep. We are growing, and it's very interdisciplinary, global health as well as Lehigh Valley, regional and national. And so it truly is an interdisciplinary, as well as beyond our College of Health. We have colleagues that would collaborate with the other colleges to meet all of our graduate students' needs. Next slide. I touched on this a little bit. All of our graduate degrees are experiential learning. So actually all of our courses, not all, but I think there's a high percent, whereas it is our mission to provide experiential learning through our coursework, even before you get to the capstone. And so we're partnering with local organizations, public and private, to provide experiential learning opportunities so that when they graduate, it is very applied and practical, and not just what is not just theoretical and what's in textbooks. And so this is covered not only through coursework, but then hit again at the capstone, internship, research with faculty. We have, I didn't mention this yet, but the college has 3 institutes, right? The Institutes for Health Policy and Politics, Institute for Children Environmental Issues, as well as the Institute for Indigenous Studies. And so through those 3 institutes, additional experiential learning opportunities for our students. Next slide. Okay, so I was ahead of, so here are, fail 1, I forgot to mention, very important, our health data warehouse, which has outstanding quantitative faculty who do their own innovative methodological research, as well as collaborating with our other faculty. Dr. McAndrew works in amazing forecasting new innovative methodologies on how to forecast the flu epidemic and pandemic, both locally, regionally, and nationally, in partnership with our other colleagues, and Dr. Bilal Khan leads the Health Data Warehouse. Next slide. And we've sort of been covering all of this, but again, career and advancement opportunities on the left side going from private for profit. So I said, we have local companies here and national. Then nonprofit, obviously we have the local hospitals, health systems here, St. Luke's, Lehigh Valley, Geisinger, and so forth. And then we have government, very important local government from Lehigh, Bethlehem, Allentown, as well as regional and then state health departments, as well as then national places like Centers for Disease Control, NIH, Agency for Healthcare Research Quality, Medicare, Medicaid, all of that, and then higher education, obviously, colleges here at Lehigh, medical, dental, nursing, other professional schools. All of these employ all of our students graduate from MPH, MS, PhD, and so forth. Next slide. Okay, so funding. Okay, so you see there, tuition is $1,500 per credit. So you just multiply that by however many each. So typically our MPH and MS I mentioned is 42 credit hours. That works out to be about $63,000. Now, what you see here is just one sample. We have many iterations. So we have everything from scholarships for obviously need-based, merit-based scholarships. We have scholarships for people working in our local partners in the Lehigh Valley Health Networks to people working in our government agencies. And so I would encourage you to ask about this. And again, it varies anything from 20, 30% all the way up to 50%. The PhD funding, we try to fund 100% of our PhD students. And then something that applies across any of these is even beyond the need or merit-based scholarships, we also have graduate assistantships. So in other words, many of our faculty have research grants or are looking for graduate and undergrad students to just work on their grants. And so that also provides a good source of stipend and income. I believe no student is allowed to work more than 20 hours a week if you're a full-time student. And that's another aspect. Some of these scholarships require you to be a full-time student. If you're part-time, obviously there's less opportunities, but there's still scholarship opportunities, but the majority of these are for full-time students to maximize your scholarship. But again, detailed questions, please follow up with myself or Jay or anybody else in the college. Next slide. Okay, so I sort of went through that pretty quick. It was meant to cover sort of high level. What I would encourage again is our website is full of very useful information. And if you can't find your answers to that, there's your email right there, cohgrad@lehigh.edu, and we will get back to you in a timely manner. Thank you. So, Jay, do we have any few questions?
Yes, so I've got one question here. Got someone asking, is it possible for the application fee to be waived?
Yes, so I would encourage you to, again, contact the College of Health grad account and request a fee waiver, and we will work with the student to help you waive the fee, yes.
Awesome, and then I've got another question here. If I was going to apply as a part-time student, how many years are you allowed to take to finish any of the master's programs?
Okay, so this is a university, Lehigh University rule. So as a part-time student or even full-time, you have up to 6 years to finish your master's degree, which is plenty of time. 6 years is plenty of time.
Absolutely. And then our last question here, is it possible to enroll part-time in the PhD program?
No, so it is not. So the PhD program, we require you to go full-time through the PhD program because it's fully funded. So I guess theoretically you could if you want to go part-time, but you would have to pay for it. So in order to go under the fully funded model, you have to go full-time. And so I believe that's the current situation, but I think on the individual basis, we can accommodate.
Mm-hmm.
You want to add anything to that, Jay?
Nope, that covers it all. Yeah, currently, just because of the fully funded status, it's not an option at the moment.
Right.
But
thanks for clarifying. That's right. PhD, you must go full time. Right.
Yeah. But thank you so much for all of the questions, and thank you so much, Juan, for the lovely presentation. And we will always be getting back to people in a timely manner at the email address listed on the screen. And thank you so much.
Thank you. Welcome.